Hello and welcome to Wisdom Wednesdays. I am Dr. Brian and I have a very, very special guest, Dr. Otero.
Hello.
Welcome to our Wisdom Wednesday. How are you today?
Good, and you?
Fantastic. I'm so glad you could join us.
I'm happy to be here.
So what we're going to talk about today is dental disease in general. It's extremely important for you guys to understand that what's going on in your pet's mouth actually affects the rest of their health. So we're going to go over a couple of fun facts over here, and then we're going to talk about a couple of definitions. We're going to go over some products, and we're going to let you know how you can know at home whether or not your patient might be having some signs of dental disease, right? Okay, good. So everyone always asks me, oh my gosh, you're going to extract 3 of my dog's teeth or 5 of my cat's teeth. Are they going to have any teeth left? And I always say yes, right? Well, most of the time. Yeah, exactly. So for you guys to know, dogs actually have 42 permanent teeth. So there's 42 teeth in there. Please don't get too scared when we're extracting 1 or 2 teeth, okay? If I say we're going to extract 42 teeth, then maybe we can have that conversation. But for cats, they actually have 30 teeth. So cats have less. She'll be right back.
What did you say, sir?
Cats have less teeth than dogs.
Thank you.
So that's just an interesting fact. So the next kind of fun fact is by the age of 3, 80% of dogs actually show or exhibit signs of dental disease. For cats at the age of 3, it's 70% of cats. So cats tack on the tartar less than the dogs. So we'll usually see cats getting dental cleanings a little bit less often, but we still do, some cats still need their yearly dental cleanings, whereas dogs definitely need the yearly dental cleanings, and our smaller dogs, oh my gosh, how often do we do those?
Every 6 months.
Every 6 months, absolutely. In order to help preserve those teeth and, make sure that they're happy and healthy, because that's our goal, right? So there's a couple of signs for you guys to take into consideration whenever you're wondering if or if not your patient has or pet has dental disease. So I think Dr. Otero is going to go over a couple of those signs. So Dr. Otero, what do you hear from your owners, or what do you see in the room that they can maybe look for at home?
So most of the time, you won't really know that there's a lot going on. And then you bring your pet in for your annual wellness exam, dog or cat, and we start noticing there is inflammation in their gums, or there may be some tartar buildup. When we see tartar buildup, and she'll go over a little bit more detail on that. When we see that, we've already been past the point where there's already some disease going on. If we see it, it's underneath the gum line. So that's one of them. Most of the time you will not see it. Sometimes, mostly on dogs, you will smell really bad breath. That's called halitosis. And that's probably one of the most common things that you come in for, where your dog is not able to give you more kisses because it really smells bad. So that's one. Shattering of the teeth is very, very common, especially in cats, where you notice that they may be dropping food, or when you touch their shin or something, you notice that they're shattering their teeth. Yeah. Cats drop food very often, so that's one sign that you can watch for on your cat. On dogs, you can notice some bleeding in their gums, you can notice bleeding in the food or the water bowl. That's most of the things that we do see. Then very, very advanced cases, you can see some discharge coming from the nose. When we see that, that's very advanced, because that means that the mouth is connected to the nose, and you would start seeing the discharge coming from the nose. So at that point, that's a bigger surgery, and it is an emergency. So that's a really big deal.
Yeah,
hopefully it doesn't get there.
Absolutely, and sometimes we can see tooth root abscesses.
Yes.
Say that 5 times fast, right? So what happens to that as well, they get swellings underneath their chin, and because the infection or abscess can't drain because the tooth is there, then that tries to drain outside your face. So any swellings on the face, we always get concerned about that as well. So that just means that infection went straight to that root, right? And there's an abscess there. So speaking of definitions, because we want to make sure that we define our words, right? It's very, very important for everyone to be on the same page, and that's what we're all about as well, as good communication. So biofilm, just want to let you guys know, biofilm is a word that we'll use from time to time, and it just means this slimy surface. So the way that the plaque and tartar start is basically just this very mild layer that you guys can't see that's very slimy, and it's like the first thing that lays down that tooth, okay? And then we have plaque, which plaque is biofilm with the bad bacteria and all the food that gets stuck in there and some enzymes and minerals, that kind of thing. But it's basically the biofilm with the bad bacteria and all the other junk that kind of gets stuck in all the crevices. So that's plaque, but this you actually can't see. So as far as the next one goes, would be tartar.
Sorry,
That's okay. So we're busy. Tartar is the next thing. So tartar is actually plaque with calcium, and it's a hard surface. So when you look in your pet's mouth and you actually see something, that is tartar. Now the key here for you guys to understand is that all this biofilm, plaque, and tartar is all essentially bacteria. And that bacteria can lay down in the heart. It's the leading cause of heart disease, it's dental disease. So it's very, very important for you to know that it's not just something in your pet's mouth, right? It's actually something that could inhibit their health. Therefore, that is why we're always harping and telling you guys and recommending these dental cleanings, because it's about the bacteria that's in their mouth, sitting there festering, and potentially could cause them life-limiting problems. And we would never want that to happen. So we're just going to run through really quickly. This is just a little model of perfect teeth. Look how pretty and white. You only get to see this on 6-month-old puppies. And then here you go. So here's some gingivitis, obviously. So gingivitis is, itis means inflammation. This is the gingiva, which is the gums. And then this is that tartar. So you can see it, right? So it means it's tartar. So it's that plaque, it's the bacteria. It's met with that calcium, and it's really laid down, and it's very, very hard. The only way to get that off is with a dental cleaning. We use the same thing as humans use. That is why we have to put on under anesthesia, because we do have to get underneath that gum line where a lot of the plaque and tartar actually lives, and they're not going to let us do that. So, but it's usually, always our anesthesia, we're very, very safe with that. So we're not really concerned with the rate of risk because of all the precautions we always talk about with you guys. We're going to go through the products a little bit. So we do recommend anything that you can use would be awesome. The things that we have available here is the water additive. So basically, water additive just helps remove the plaque biofilm and then freshens the breath, right? And then, so this you just put in the water. It's like an everyday thing. So it's really nice because it's something that they get every day. Another thing that they would get every single day would be like the diet, so dental food, okay? So this acts in a couple of ways. The kibbles are designed to actually contact those teeth a little bit and act like a grinding motion. So they're going to get on there. It's like a physical, mechanical motion in order to get some of that plaque and tartar off. And then it also, once they swallow it, there are some enzymes that come back out through the saliva that actually inhibits the calcium to attach to the plaque. And then if there's no plaque and calcium, there's actually no tartar, which is that end result, right? So it's inhibiting the calcium from actually sticking to those teeth. So this would be, obviously something on an everyday basis that the patient would eat. Cats, dogs, it doesn't matter. And it would be, really good benefit in order to prolong out those dental cleanings. This Oravit is brand new on the market. This is basically a sealant. So anyone who has kids, you know about sealants and teeth. Oh my gosh. So basically what happens is they eat this chew or this treat, and it has a sealant in the middle. So it will seal over the teeth. Now, of course, the purpose of that is once have a sealant on them, nothing can attach. So that would be, pretty amazing and awesome. So these you're supposed to use every day, every other day, that kind of thing, to put that sealant constantly on that teeth, all right?
And you can use it as a treat, so you don't have to give any other treats at home.
Right.
They smell really good, and dogs really do love it. So.
Yeah, we're actually, people are coming back and are like, wow, I want more. But let's be real here. The best thing you could ever do, right, is brushing teeth. Because I know my dentist, for me, always says, hey, I'm going to need you to brush those teeth twice a day. So that is the best thing you can do in order to prevent all of these things to happen. You need to make sure that you're using animal toothpaste that cannot use human toothpaste. You can either use a toothbrush From the veterinary side, you can get a finger brush, you can get a washcloth for all I care. It just needs to be that motion on there, some gauze, sponges, whatever. You can even put the toothpaste on toys and have them eat their toys, or even, you know, something as simple as maybe giving your retriever a carrot could be more of that mechanical motion. So that's what we have here, just a little picture of a before and after to give you some mass. We're going to attach some pictures on the bottom of this so you guys can see some before and afters. We actually take before and after pictures of all of our patients that are going under for a dental cleaning, and we text them to the owner so you guys can really see what's going on, what we see. And it's pretty amazing. And I know for you and I, we always hear how much better the patient is doing after a dental cleaning.
Yes.
Oh,
And it's
my
not
gosh.
only the smell, like it's in general. Like sometimes the activity level goes up because it is a source of pain, it is a source of chronic pain. So the pain is there, and you will notice a difference once the teeth are nice and clean and you can kiss your pet again.
Absolutely. You don't want to wait till it's too late because then we're pulling all those teeth, right? We're going to try to preserve them. Want to keep them.
Yes.
Keep the teeth. All right. Bye, guys. See you next time.
Bye.